Well, good afternoon, everyone. My name's Jeremy Buckingham. I'm a MLC with the Legalise Cannabis Party. Michael and Ian, if you grab a seat down there.
Sure. No worries.
Well, I'll call you up. Welcome to New South Wales Parliament, the beautiful Jubilee Room here for our Road to Justice forum on the need for a medical defence for people with a prescription for medicinal cannabis to be able to drive on New South Wales roads. Thank you all for your attendance. I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the lands upon which we are meeting, and acknowledge all of you, so many friends and fantastic advocates who have championed this cause for far too long. I'd also like to begin by thanking my great friend, Alex Greenwich, for his political support and for co-hosting this forum with us. It's incredibly important. And for signing on to a letter with myself and Dr. Joe McGregor, the member for Wagga Wagga, and the Speaker of the Legislative Assembly, Greg Piper, who wrote to the Premier last week urging he and the government to act in this space. The forum is called The Road to Justice. There have been, and I must acknowledge we've got Greens MP Kate Fairman here as well, who has been campaigning for this for a long time. The road for justice, the road to justice, has been a long one and I would say an unnecessarily long road. This is unfinished business when it comes to medicinal cannabis reform in this country, and that is we put the sort of cart before the horse, or we forgot about the cart when we legalised the horse when it came to medicinal cannabis, in that we legalised medicinal cannabis, but we didn't really think about its impact on road users and how it intersects with the state's comprehensive RDT program. So that evidence has been heard by this Parliament ad nauseum, I would say, through a number of inquiries, a specific inquiry that Kate chaired, the inquiry that looked into the regulatory reform of cannabis, made recommendations about reform, and we've also had the government's drug summit, which again heard from people across the state who were saying that they are being discriminated against and unfairly criminalised by a regime that hasn't caught up to the science and the need in the community. So thank you again for your attendance. We're going to hear from a number of experts in this area. We have Professor David Heilpern, who's going to come and speak to us, an expert and a former magistrate and expert in the law, a professor and dean of law at Southern Cross Uni. We have Michael James, a veteran, a person with lived experience. We have Will Tregoning from Unharm, leading the charge in terms of that advocacy. We have Professor Iain McGregor from the Lambert initiative. No one knows more about cannabis, cannabinoids or hedonic tone than Professor McGregor. And then at the end, I will be hearing from Alex on how we plot the pathway to the reform that we need, and we convince the politicians that this is something that we need to do and can be done safely. So with that said, and at the end we'll have a panel discussion and a bit of Q&A. So with that said, thank you again for your attendance. Really, really appreciate it. I'll now hand over to Professor Heilpern for 5 minutes on his experience as a magistrate and a Dean of Law. Thank you, David.
Five minutes, really. Yeah, I'm here now. What are you going to do? So, in 2021, I left the bench, and I did so largely because of this completely stupid law. So many people were coming before me who were medicinal cannabis users who were losing their licences. And I couldn't go home and sleep at night knowing that what I was doing was so extraordinarily unjust. After all, the human cost of the current regime is extreme, and I'll come to that. I'm pleased to support any progress in this area, but the best system would be one that, as the Upper House inquiry said, stops criminalising medicinal cannabis users in terms of their driving. I think that we, in so doing, it gives voice to what has been the most comprehensive, public, open, expert-driven program in New South Wales in drug law reform, and that is the Drug Summit. That is what the Drug Summit has recommended. That was parliamentarians, police, health experts, drug and alcohol counsellors, members of the public who had interest. And we saw that as a bipartisan, and who has opposed that recommendation? I've not heard a word in opposition. I sat there with a National Party member who I'd never met before, and we talked about drug law reform, and we talked about drug driving law reform, and I know what he's been doing in this House since, and that is saying, what are we doing? So one of the errors I think we made early on was we focused on why we needed to change. I think that a more appropriate focus at this point is what happens if we don't. And what happens if we don't is tens of thousands of people in this state continue to lose their licence, continue to be criminalised. Hundreds of thousands of people now have prescriptions, and yet they either run the gauntlet or they are apprehended, and the results are catastrophic in terms of their jobs, their families, their housing. There's also the financial cost to the courts, to the number. These aren't quick tests. Hundreds of police are on the roadside now, as we speak, administering these tests when they could be doing far more effective policing in areas that we all really care about. But also, this scheme, that is the random drug testing scheme for THC, is funded by road safety dollars. There is a transfer of money from road safety to police to administer this scheme. That road safety money should be spent on programs that are proven effective. There is no proof that this is effective. There is nowhere else in the world that has random THC drug tests on the scale that we have them without a medicinal exemption or defence. Nowhere. And why Germany has just introduced legalisation of cannabis, and they have a regime for road testing which has exemptions for medicinal cannabis users. There's also the fact that none of us would be here if we thought for one moment that changing this regime would lead to more road deaths. I mean, none of us are here in the business of saying we want more road trauma. Yet what this is doing, the current scheme, is forcing people off cannabis back to their other medications. That is their benzodiazepines, their opioids, their barbiturates, their anti-anxiety medications, all of which are proven to have a greater impact on road safety than THC when used in accordance with prescription. So what are we doing? We're wasting money on a program that is unproven and that, in my view, increases road trauma risk. I mean, where's the evidence from Tasmania? They've had a defence for ever since cannabis became available by prescription, and yet no one is arguing that there is an increase in road trauma. In fact, worldwide, there is not a single study that shows that if you have a medicinal exemption, it increases road trauma. So what are we doing and why are we doing it? Well, there's 4 myths. And every time I speak to parliaments or parliamentarians, the same myths come up that I just want to briefly deal with. First, there's no guarantee that the origin of these drugs will be legal as opposed to illegal. Well, whoopee-doo. No one cares if you've stolen the beer that you drink drive with, let alone home brew. No one really cares if the prescription drugs you use were bought at the pub or bought at the chemist. We're talking about road safety, not the origin of the drug. The second myth is that we're right on the cusp of getting impairment testing at the roadside that will work really well. And please don't do anything now. Just wait a year or wait 2 years or wait just a little while. We'll have this magic test that we can do things with. Well, I call bullshit on that. There is no magic test coming because of the idiosyncratic nature of cannabis use. And I'm sure that Professor McGregor will disagree with me if I'm wrong, or agree with me if I'm wrong. And who is opposing this now? Well, it's not the opposition. It seems to be some bureaucrats. And when Kate had the upper house inquiry, there was two things that really struck me. A road safety bureaucrat came and said, medicinal cannabis causes more road deaths. And they were leapt on, and they had to backpedal from that position, but only in that forum. Generally, they don't backpedal at all. Secondly, there was someone from the Ministry of Health who said that cannabis has no medicinal benefit whatsoever. So there seems to be opposition. It seems to be coming from a very narrow band of the bureaucracy rather than from parliamentarians who, after all, were involved in the drug summit and bipartisan involved in Jeremy's latest inquiry. I want to leave you with this thought. Imagine there was a new drug called Relief. It came from America and took off in Australia. It wasn't on the PBS, but within 5 years, there were 1 million scripts written. It helped with insomnia, PTSD, chronic pain, epilepsy, anxiety, and it worked. No one for one moment would suggest, oh, let's have a detection level test on that new drug. Why? Because it would be the same as every other new prescription drug. There is a regime. It's called drive under the influence. It applies to all of those kinds of offences. But nobody would suggest a detection offence. The only reason we have one for THC is because it once was completely illicit. Those days have gone, and the law just has not caught up with the reality. So I want a T-shirt, and Jeremy's going to produce 10,000 of them, this is the first he's heard of them, which says, just like every other prescription drug. Because actually that's the answer to every objection that's raised to this. Just like every prescription drug. And then I can just point to it when people ask me questions or raise propositions, because after all, that is what happens with every other prescription drug. Thanks very much.
Brilliant. Thank you so much, Professor. Really appreciate that. Always eloquent and verbose. Our next speaker is Michael James. Michael is a retired soldier who served with the Royal Australian Corps of Military Police for 15 years. He's a veteran, including several overseas operations. After leaving the military, he continued his service to the veteran community through the Returned and Services League, where he held roles as sub-branch vice president and district vice president. Michael also played a key role in establishing the Defence Shed in Wagga Wagga, creating a place of support, camaraderie and purpose for veterans. Today, he remains dedicated to supporting fellow servicemen and women and strengthening community connections. He's here to talk to us about his lived experience as a medicinal cannabis patient living in regional New South Wales. Michael James, come on up.
We don't want to be getting calls now, do we? Good afternoon. Thank you for the opportunity to speak here today. This is an issue that can save lives, restore dignity, and protect some of Australia's most vulnerable people. My name is Michael James. I live in a small country town in New South Wales. I'm a veteran with 15 years of service, including several overseas deployments. Like many others, I came home carrying both visible and invisible wounds. I've endured an ankle reconstruction, a knee replacement at just 47 years of age, and post-traumatic stress disorder. These are just a few of my injuries that caused me to live in pain daily. For years, I was prescribed a cocktail of medications that left me with kidney problems, stomach issues, sleep issues, and weight gain. At my worst, I'd reached 130 kilos and couldn't hold a clear thought or meaningful conversation. I'd become a passenger in my own story, and the thought of ending my life was ever present due to pain and confusion. I knew I had to heal myself. Wanting to take back control, I stopped all prescribed medication. I lived in pain and confusion for 5 years. Then 3 years ago, after knee replacement surgery, I was offered medical cannabis. I gave it a go, and I've never looked back since. My thoughts are clear, my pain is managed, I no longer suffer the side effects of polypharmacy. For me, medical cannabis has been life-changing. But then came the stigma. Recently, I was pulled over for a roadside drug test. I told the officer I was prescribed medical cannabis. He laughed at me, tested me twice, and I was given a fine for $600. I hadn't taken my medication for over 12 hours. I was not impaired. Yet under New South Wales law, I was treated like a criminal. That left me feeling humiliated and embarrassed. That moment broke something inside me. Since then, I've stopped venturing out, I've stopped driving, and I've stopped socialising. I've had to give up things that keep me healthy and connected, like going to a defence shed in Wagga or Pro Patria, to be with other veterans and first-line responders who support me in my recovery. Even something as simple as meeting my partner for a coffee has become a problem. And the hardest part, explaining to my children why I'm so hesitant to drive. How do I tell my sons, Dad can't come get you today because I'm worried about being pulled over by the police? All of this after serving my country with honour, only to come out the other side a bit worse for wear. And here's the really unfair part. Patients taking opioids, benzodiazepines, sleeping tablets and antidepressants are allowed to drive provided they're not impaired. Yet patients like me prescribed cannabis are penalised automatically, even when we're perfectly safe to drive. That's not justice, and it's not common sense. This is where I speak from a unique position. I served as service police. I formerly dealt with ADF members for illicit drug use. I know the difference. Prescribed medication is not the same as recreational use, yet the laws treat them as identical. Right now, patients are forced into an impossible choice. Take our medication, gain quality of life but risk big fines or losing our licence altogether, or avoid our medication, live in pain, spiral mentally and strain our families even more just to drive legally. Ask yourself, would you rather a veteran off his meds and unstable behind the wheel, or a veteran like myself, calm, aware and safe because of prescribed medical cannabis? Cannabis helps me sleep, stay calm and remain focused. In my case, it makes me safer, not riskier on the roads. I fully support stopping impaired drivers, but we must remove the testing for presence to testing for impairment. That is fairness. Other states are moving towards impairment-based testing. Tasmania has already taken steps, and New South Wales has an opportunity to lead the way. This isn't just about safety, it's also about science, education and compassion. Veterans like myself wore this nation's uniform and accepted the risks of service. We don't want special treatment, we want fairness. Please don't criminalise us for following medical advice, and please don't punish us for choosing a medicine that works. I've seen too many of my mates lose their families, their independence, and sometimes their lives to polypharmacy. We finally have something that works, yet stigma and outdated laws keep us sick. Let me be clear, I'm not a recreational marijuana user. I'm a patient prescribed a legal medicine to treat injuries sustained in service to this country. Recreational use and medical use are not the same. It is time our laws recognise that difference. If you don't hear anything else I've said today, please hear this. I fought for this country. I accepted the risks of service. Now all I ask is freedom to live with dignity, and I don't think that's too much to ask. Please change the current laws around roadside drug testing. Thank you.
Wow, that was very, very powerful. Thank you very much, Michael, for your service and for your testimony here today. Our next speaker is Will Tregoning. Will Tregoning is the co-founder and CEO of Unharm, a national organisation campaigning for compassionate, evidence-based drug policy reform. With a background in public health and communications, he has played a key role in shifting Australia's drug law debate away from stigma and punishment towards health, human rights and harm reduction. Will is widely recognised for building grassroots movements and pushing for policies that put people and communities first. Will, come on up. Thanks, mate.
Thank you. So I'm Will Tregoning, CEO of Unharm. We've just heard from Professor David Heilpern outlining the legal framework, and from Michael, who served our community in uniform, only to lose his licence for following his doctor's prescription. Shortly we'll hear from Professor Iain McGregor as well, who will explain the clinical evidence. My role is to connect these dots and show you why reform isn't just necessary, it's urgent and achievable. Here's the reality facing thousands of New South Wales residents. Take your prescribed medication and lose your right to drive. Or skip that medication and keep your licence. This is the impossible choice we've created for people following their doctor's orders. This isn't about impairment. Our own police acknowledge their saliva tests cannot determine impairment. And research shows that driving skills typically recover 5 hours after cannabis use, whereas blood tests can detect traces for up to a month. We're criminalising yesterday's medicine as if it were today's intoxication. Consider Sarah, one of Unharm's supporters, who had to abandon her regional home and career when medicinal cannabis finally controlled her chronic condition. The medicine didn't impair her, but she couldn't legally drive for work anymore, so she had to leave her home and her career behind to move to an area with public transportation. Or the Lismore woman whose chronic migraines disappeared after 30 years thanks to prescribed cannabis. Her miracle treatment became a sentence to home detention because she lives in an area with limited public transport. These aren't isolated cases. With 1 million medicinal cannabis prescriptions across the country, this is a law that is affecting hundreds of thousands of patients in New South Wales every day. The current law creates dangerous incentives as well. Some patients skip their medication to keep their right to drive, creating exactly the kind of impairment risk we should prevent. Having fewer than 6 hours sleep doubles the crash risk, yet we're pushing patients toward that outcome. Others switch to more harmful alternatives. One parent we've heard from watched his son abandon helpful doctor-prescribed cannabis for alcohol, simply because drinking doesn't trigger roadside tests the next day. Meanwhile, the law silences the very professionals who should be helping. When medicinal cannabis is treated as an illegal drug for driving purposes, doctors, nurses, and pharmacists cannot provide the safety guidance they routinely give for other medications. We've gagged the experts patients trust most. The solution is straightforward. Treat medicinal cannabis like any other prescription medication. Amend the definition of illicit drug in the Road Transport Act to exclude cannabis prescribed by doctors and taken according to prescription. And crucially, this exemption must be available roadside. Victoria's approach, where they've kept presence illegal while giving patients the one-off chance to defend themselves in court, that misses the point entirely. Patients still face licence suspension, insurance exclusions, and legal costs during those court proceedings. When presence equals criminal offence, patients remain unprotected and uninsured. That's another crucial issue that's rarely discussed around when we talk about driving and medicinal cannabis, insurance. Some people claim a court-based defence would fix this and allow patients to drive with confidence. But even if courts dismiss charges, patients would still be driving uninsured. Imagine being in an accident that wasn't your fault, only to discover you're not covered because traces of prescription medication were detected. This insurance void affects everyone. When medicinal patients can't get coverage, the broader community bears the financial risk of uninsured drivers. Only recognition of the legality of prescription medicine will solve the insurance problem. Now, I know some worry about police liability and enforcement challenges. The reality is that this reform strengthens police positions. Instead of relying on unreliable saliva tests that explicitly cannot determine impairment, officers could make decisions based on two clear factors: verified prescription status and observed signs of impairment. New South Wales Police already use a medicinal cannabis operational guideline to identify legitimate prescriptions, and they routinely take formal statements and assess credibility. The skills exist, we just need the law to catch up. We're not pioneering untested territory either. The UK, Germany, Ireland, Israel and Norway have all enabled medicinal cannabis patients to drive. Even in Australia, Tasmania includes a legal defence for prescribed medicinal cannabis patients who are driving when unimpaired. These jurisdictions haven't seen safety problems. They've achieved better balance between protection and proportionality. And in fact, jurisdictions that have legalised medicinal cannabis and do not have random roadside saliva testing have seen reductions in crash fatalities. Let's be clear how we got here. When the federal government legalised medicinal cannabis in 2016, New South Wales simply forgot to update its driving laws. Nearly 10 years later, we're still treating illegal medicine as an illegal drug. When governments make major policy changes, they should align other laws accordingly. The failure to do this has undermined the very policy goals behind medicinal cannabis legalisation. The New South Wales Drug Summit urgently recommended fixing this. The recent parliamentary inquiry into cannabis reached the same conclusion. We have the evidence, we have the recommendations, and we have the solution. Reform would immediately unlock the professional expertise that patients need. Doctors could finally provide the same driving guidance they give for other medications, advice about timing, dosage effects, and recognising impairment. This clinical support would enhance safety far better than our current approach of blanket prohibition. What we need now is action. Not half measures that send patients to court, not band-aid solutions that leave insurance gaps, complete medical exemption that allows unimpaired patients to drive safely with full legal protection. Every day, more Sarahs lose their livelihood, more regional residents become prisoners in their homes. More patients have to choose between mobility and medicine. This Parliament has the power to end this injustice today. The question isn't whether we should act, it's whether we'll act with the urgency this issue demands. Thank you.
Thank you so much, Will. Our next speaker is Professor Iain McGregor. Professor McGregor is Academic Director of the Lambert Initiative for Cannabinoid Therapeutics at the University of Sydney and a leading Australian and global researcher on cannabis and cannabinoid medicines. His work spans drug discovery, clinical trials and real-world studies into epilepsy, anxiety, pain, patient safety and product quality. He also leads pioneering studies on psychedelic therapies, including psilocybin for anorexia nervosa. The startup company Canoxus Therapeutics emerged from his discoveries around the effects of oxytocin and addictive behaviours. Professor McGregor oversees a world-class team advancing cannabinoid and psychopharmacological science. He has provided expert evidence to many government inquiries and medico-legal cases around driving and workplace impairment and conducted world-leading research on the magnitude and duration of cannabinoid effects on driving. Professor. Thanks, mate. You too, mate.
Well, it's great to be here. That was quite an introduction. I think the reality is that I'm going to say exactly the same as all the previous speakers, but in a Scottish accent. I lead the Lambert initiative at the University of Sydney, and we kind of stumbled into driving research almost by accident, because as soon as we started talking to patients and looking at how medicinal cannabis was being used, it was evident that this was an incredibly important issue to patients. And as scientists, we decided that we had to broach this issue and use our science to explore the effects on cannabis and driving and provide unbiased data to the community, both here in Australia and worldwide. And we have actually had a lot of fun doing cannabis driving research. So this is a long overdue reform in my mind that we're talking about today. There's no real scientific justification for the current laws and the current approach. As has been pointed out already this afternoon, there are patients going around, hundreds of thousands of patients with prescribed medications that are far more impairing than cannabis is. And there is no justification for the double standard where we treat medicinal cannabis any differently to opioids, benzos, drugs, sedating antidepressants, sedating antihistamines, you name it. In fact, all these other prescription medications impair driving to a greater degree than cannabis and elevate the crash risk to a greater degree than cannabis does. So we really do have a double standard here. Now, our research does show that you can get some impairment with cannabis. I mean, some of the fun we've had have been getting people to vaporize cannabis, recreational users. And in one study, we sent them out in the Netherlands to drive on normal roads for 100 kilometers after a couple of bongs. And that was very interesting. They were in a Volkswagen that had dual controls, so they were with an instructor, and recorded all the data that we could. It was a specially instrumented Volkswagen Golf. What we found was they were generally safe, nothing bad happened. They reported being quite intoxicated, some of them. There's a mild increase in weaving from side to side, which is akin to what you see with about 0.02 to 0.04 blood alcohol concentrations. That's what we saw. Now, the important thing to point out was these were occasional cannabis users. These were people that had cannabis maybe once every couple of weeks, once every month. What we know is that you get profound tolerance to these effects. If you're a daily user or a medicinal user, it's actually very, very hard to detect any impairment whatsoever, even with that side-to-side measure. We also know that cannabis does two pro-safety things on driving, which are quite interesting. Cannabis users tend to drive at a slower speed. That's been shown in many studies. And they also leave a longer distance between their car and the car in front. You may have actually witnessed this on some roads in northern New South Wales. So on many measures, they're safer. On measures of weaving, perhaps a little bit less safe. Drug-drug interactions are perhaps an issue as well. But I think, as David said, there's yet to be a study anywhere in the world that has shown that medicinal cannabis use, the use of medicinal cannabis products as intended and as advised by your doctor, causes any impairment whatsoever. That's a really, really important point. The next point we've investigated relates to roadside drug testing and the technologies that are being used by the police in New South Wales and other states and territories in Australia to detect the presence of THC. The first point, which has already been made, is that there is very little correlation whatsoever between your salivary concentrations of THC and your cognitive or driving impairment. That correlation is extremely weak. Same goes for blood THC concentrations as well. That correlation is extremely weak. We've crunched the data for every study that's ever been done in this area and done fancy maths to show that the correlation is hardly worth worrying about. These devices are also very prone to false positives. So people that have negligible or no THC in their saliva. We had an elderly woman in one of our clinical trials in insomnia who'd never tried cannabis in her life. And we did a Draeger drug wipe with her, and it looked like she'd had THC in her saliva. We put the false positive rate at about 10%. And then there's all these false negatives as well. These are people that actually have very high levels of THC in saliva and come back with a negative test. So, we no longer are allowed access to these devices from the manufacturers because our published studies show how poor they are in terms of their quality. That's how they operate. So it's a real problem. RDT, roadside drug testing, serves as a major disincentive, as we've heard from Michael, for patients to actually take up medicinal cannabis or to drive if they're using medicinal cannabis. In a recent study we did of more than 300 users in the ACT, more than 60% of them said that RDT was a major inhibitor of their use of their prescribed product. So it's having an impact. And that doesn't even describe the hundreds of thousands of people who don't take up medicinal cannabis as a legitimate option, who would like to use medicinal cannabis as an option for their condition, but are too terrified of the consequences of being criminalized. And we talk to these people just about every day. They're in our clinical trials. We have people that would love to be in our clinical trials in pain and mental health conditions, but when they learn that they're not allowed to drive, they immediately withdraw. So this is an issue that we really have to solve. And I've heard from everyone today that other jurisdictions appear to be able to manage this issue without the sky caving in, without any major problems, without any detectable effects on road trauma statistics. We see it in Germany, we see it in the UK, we see it in Ireland. I've spoken to the Tasmanian police about what they do unofficially, and they manage it just fine down there, and there's not a problem, and there's nothing they can detect in their motor vehicle accident statistics that suggest they are any different to any other jurisdiction in Australia. So it's time to implement this long overdue reform. Science backs this reform, so let's get on with this.
Thank you very much, Ian. Our last speaker is the member for Sydney, Alex Greenwich. Come on up, Alex. Alex is a fantastic fellow, championed a number of incredible social reforms successfully in this state, and no better person to shepherd this reform through the bear pit of the Legislative Assembly and through the many cogs of government and bureaucracy. So, Alex, thank you for your support, and over to you.
Thank you, Jeremy.
Thank you.
Thanks so much, Jeremy, and good afternoon, friends. It is really great to be with you here on Gadigal land for this really important forum. It is also really great to see the Honourable Kate Fairman, Sue Higginson here as well. We have Joe Heilpern, the member for Summer Hill, my colleague, the independent member for Wagga Wagga, Dr. Joe McGregor, and also the Honourable John Brogden, who was one of the co-chairs of the Drug Summit. It is wonderful that you are here today, as we all are working hard to implement your recommendations from the Drug Summit in regards to this. So the current situation, as we have heard today, is ridiculous and untenable. The good news is we are working on fixing it. Today, in question time, in response to a question from me to the Minister for Roads, they made it clear that they are working with my office and others towards legislative solutions to address this. We are working towards that. There is still more work to do, but was clear from the Minister's answer that she understands the problem and that the government, in the context of their response to the Drug Summit, are working on a response to this. And so I'm really grateful for that forward action. Also in question time today, I informed the Chamber that I am one of those hundreds of thousands of people in New South Wales that use medical cannabis. I use it to help me with anxiety and insomnia. And that doesn't make me unique, because there are hundreds of thousands of people in that situation. But I'm actually really fortunate because, as Jeremy introduced me, I'm the member for Sydney. And as the Lord Mayor of Sydney reminds me, I can walk and cycle everywhere. And I really shouldn't be driving and adding to congestion or parking. But as we heard from Michael, I'm in a really fortunate position. You know, I look at the fact that we've just gone through Father's Day, and I have friends and constituents who had to work out whether they were going to see their dad on Father's Day or not, or how they are going to see it. Not because of their driving record, not because of any impairment, but because they didn't want the risk of being pulled over, being pinged with having some THC in their system, and then potentially have to go through a court process, have a fine, and kind of explain that to dad, or have dad explain that to their kids. And I know certainly as an MP, you don't want to get pulled over and have a positive drug test, despite the fact that it will have no impact on my driving record, which, despite what my husband says, is a perfect driving record. I also want to give a big shout out to Unharm, Uniting, and the HSU, the ICLC who are here, and all the advocates that are here for reform. This was all an issue which we raised at the Drug Summit. This has got to be the low-hanging fruit of the Drug Summit, a common sense reform that really just makes the lives of people across New South Wales a bit easier by making our driving laws fairer. So I'm committed to working with all of my colleagues. I'm committed to continuing to push the government. I'm really grateful to Jeremy, but also my independent colleagues in the Legislative Assembly, Dr. Joe McGregor, who is a hugely respected member of the Legislative Assembly, and obviously the Speaker, Greg Piper. All of us have written to the Premier saying that we expect action in this area. We have met with the Premier. We have discussed this directly with him. And I look forward to hopefully this year seeing reform be achieved to make people's lives easier, to ensure that people don't have to make a decision between, taking their script, taking their doctor's advice and doing their job, visiting a friend or loved one, or taking their medicine. Other states and jurisdictions have fixed this. New South Wales not only can, but it will. So thank you, Jeremy.
Well, thank you very much, Alex. Really appreciate it. And I'd like to also acknowledge all the members of Parliament that have come to this forum, and John Brogden, the co-chair of the Drug Summit, for coming along and for the great work he did in that process. Before we concluded, we just thought we'd have a couple of minutes for questions. So if the presenters could come up to the table. So Will, Alex, and the professors up the front. I'll just MC a few questions, possibly from the floor, which you'll answer correctly, and
We're the right wing.
then we will conclude. So, do I have any questions from the floor? Yes, John.
I just wanted to make a point with respect to the recommendation and how it might flow through to the law. The recommendation asked for consideration of the manner in which this would be dealt with on the roadside. And I know there will be many who will just be relieved if there's a defence. But one issue that I think needs considerable attention is whether or not police have the capacity to wave you through at the roadside or require you to go to court. Now, if you go to court, it'll cost you a day off your job if the court gets to you on that day. If you are inclined to, it'll cost you a solicitor. It'll cost you the risk that people who you know and with whom you work who aren't comfortable with you taking marijuana because they don't understand what we're talking about. So people could literally lose their jobs, illegally of course, but they could lose their jobs and lose their reputations. And that doesn't matter for those of us who would go to court in the great metropolis of Sydney. But think of country towns with their own newspapers and radio and television, and Joe, you know what I mean, the capacity for that to become a story. So what police need in order to wave you through on the roadside is a matter of serious consideration. I don't know if it's a prescription or it's a letter from the government. It was suggested to transport, but this isn't a question, by the way.
I can tell. But it's a pretty good speech.
As I learned in Parliament, Alex, it's called question time, not answer time. We did talk about whether or not it could be flagged on your electronic licence. Frankly, the view of transport was, what else do you put on the licence? You know, what other 100 things do you put on the licence? So there was some reluctance. So this is a really important issue because we might get what we want in terms of an exemption, in terms of a defence, but how that defence is practically implemented is very, very important. And we need to make sure police on the road, men and women, don't get in any way too concerned about the use of discretion. During the drug summit, one day people wanted discretion, the next minute they didn't. If you're a young police officer on the roadside and you have discretion, frankly, you could be quite panicked about using discretion if that person drives around the corner and something goes wrong. Whether it's to do with their impairment or medical marijuana use is irrelevant. So we need to be very clear on this issue, and I don't think we should settle for simply being required to go to court. I think we can do a lot better. Former magistrate would have a view on that, but I'll make that point.
No, thank you, John. It is a very important point, one that has excited a lot of discussion. A response, maybe if you could kick off, David.
Sure. Look, in Tasmania, no matters get to court because what happens is representations are made to the prosecution and they then withdraw the charges. In other words, but the matters are sent to court, correct, and that is a disadvantage. Of course, police have discretion in any event, and I do think that guidelines for the exercise of that are appropriate. There's nothing wrong with a system where, just like if my windscreen wiper has a crack in it and the police see it, they say, I want you to fix this, come to the police station within 24 hours. That's how it works. So if people don't have their script on them, then they can be told to do that within a time frame. If there's no other indicia of intoxication, weaving all over the road. The average prescription drug user for THC is a 48-year-old female. So we're looking at a lot of people being pulled over where the police would be able to exercise their discretion. Of course, the problem is then they don't do the second or the third tests. So it's not without its problems, but as on my T-shirt, treat it like every other prescription drug. And that really does solve the problem because this happens with, why don't people have to show their prescription for Valium? And the answer is, if there is indicia of intoxication, the police have powers to arrest, take to a hospital, give them a blood test, get an expert's report. So I think my model, the ideal model would be treat it like you do every other prescription drug, and that gets over all of these problems. Hope that helps.
And can I just throw in one more thing in support of John's point, which I completely agree with. I mean, the other challenge is what happens to that person and their capacity to drive, why they are waiting for a date in court. We can't have a situation where people can't get to their job because they are just following their doctor's advice and they are in no other way impaired. So for so many reasons, just relying on a test in court, in my view, is not sufficient.
Yeah, thank you, Professor.
Just in my off-the-record briefing with Tasmanian Police, I was quite a senior person, I was told that highway patrol officers are trained to de-escalate the situation and not go forward to court. So that might be one of the reasons that there are no court matters as well. It would be worth getting an on-the-record briefing on that point from the Tassie Police because it may point a way ahead for New South Wales.
Does anyone else want to make a contribution?
No, I would just say that I completely endorse the point that John Brogdon's made here. It is an absolutely critical point. MINS has reportedly made a commitment to go ahead with the reform. I've seen that reported in media. The main job now is to make sure that they actually fix the problem. And having a non-court process, I think, is the most urgent piece of business in getting this reform right.
Thanks. Any other questions? Joe, you had one?
Yeah, thanks, Jeremy.
Dr. Joe McGregor.
For raising that point. My question sort of follows on a little bit from this discussion. There was discussion earlier about opposition, and perhaps opposition from within the bureaucracy. And it seems to me actually there is opposition from within the police, and that a lot of the opposition within the bureaucracy may actually indirectly stem from that. And it seems to me that it might relate to the difficulties or otherwise of testing for impairment at the roadside. And I just raise that to see if that makes sense. This is not a criticism of the police, it's just they don't need another job to do, but it seems to me that that is kind of maybe a sticking point that we need to work through. I don't know what the panel think of that, I don't know how you work through. I don't know if impairment testing by the side of the road is such a big deal for them. Looking at a script would be easy, but...
I think I can answer that in a way, and that is if police suspect that somebody is driving under the influence, that is, they're impaired, then they should be charged with that. If there is no reasonable suspicion of that, they should be waved through. Now, of all the drug driving matters I saw as a magistrate, thousands and thousands of them, they all said the person did not appear to be impaired. Otherwise, they would have been charged with something else and there would have been an investigative process. So if someone's got a script and they're not visually impaired, then they can be waved through. And to me, you know, drug law reform is one area where the police seem to have broken a normal rule, which is we don't comment on public policy when it's before the Parliament. We just let Parliament make its rules. They don't do that with drug law reform, and they haven't with drug driving, unfortunately. But each of the reforms, I think it's fair to say, in drug law reform over the last 20 to 30 years have been despite the police opposition to it. So I guess we're in the same bag as we've always been.
Thank you. Anyone else?
Our
Will?
advice was leave impairment law alone.
Yep.
Because you could be impaired because you haven't slept for 3 days, because you had a diabetic incident, any number of things. So leave impairment law alone and deal with the Poisons Act or whatever it needs to be over here.
The Road Transport Act. Will?
Yeah, I mean, as John says, Section 111 deals with the presence offences. 112 deals with the impairment offence. There's no suggestion, I think no one on the panel is suggesting any reform to the impairment rules. And in addition to that, these can be implemented using existing police protocols. There is already a sobriety assessment that...
I guess I get that, but I'm just saying there still seems to be an opposition from the police on this, and that could be a real sticking point. I agree with you, and I agree with the point about leaving impairment law alone, but for some reason it still seems to be a problem for them.
Yeah, and I guess perhaps that in part is about that reassurance that that what's being proposed actually can be simply implemented using those existing protocols, and also just highlighting the current problem whereby they're relying on a test, as Iain has described, that has a high false negative rate in order to wave people on right now. So they're already, that risk that they would be concerned about in being responsible for waving someone on who might in fact be impaired is a risk that is greater when they are relying on these unreliable tests in order to make the assessment.
That's a really good point, actually. That's false negative rate.
Can I speak to the
Yes, of course you can, Iain.
the mythical cannibalizer, you know, the equivalent of the breathalyzer, but for cannabis, doesn't exist. And I have colleagues all around the world who are trying to get a rapid test for cannabis-induced impairment, and it is fiendishly difficult. And we're nowhere near achieving that yet, despite lots of top researchers trying. So it's not going to work that we get a device that will immediately show cannabis-induced impairment anytime soon. But this is a very real issue in the mining industry, and I've worked with quite a few mining companies who want to allow someone with Crohn's disease to use THC before they go to sleep at night, so they arrive at the mine site fresh as a daisy after a good night's sleep in the morning, rather than as an insomniac. So they're very interested in, is there a cognitive test, for example, that will show cannabis impairment? And yes, there are, but we need baselines. So if you're an employee of a company, they can test you at baseline and then test you randomly from then on to make sure that there's not massive cognitive impairment. But we can't do that with the police because we'd have to test the whole population. One way of telling cannabis impairment is how long you can stand on one leg with your eyes shut. That's probably the best test at the moment. But for the police to implement that, you would need to have the whole population tested for that and given a figure, because obviously an 85-year-old is going to perform differently to an 18-year-old. But this is a red-hot area, and maybe we will be able to solve it one day. Who knows?
Thank you. We'll just take one more question if they're... Okay, yes.
Mine, I suppose, goes to the framing way in which you presented this, and also kind of goes to something you mentioned in your second written speech in the 2nd of August. Is it, I suppose, tell me about why the basis is to have a defence available and a carve-out, which, as quite rightly pointed out, it takes one to go all the way to court rather than police discretion perhaps being utilised, instead of that which was put forward in your Unharm report, Will, of why don't you just simply change the definition under Section 4 of prescribed illicit substance to have the carve-out that unless it's prescribed for and utilised, that would then kind of be the ilk of the THC prescription. So I suppose instead of having a defence available, which would be the same as with his morphine and we can get into an argument as to the amount of people that are taking morphine and driving versus those taking cannabis and driving on a prescribed basis. But why is the legislation being framed like that as opposed to simply a Section 4 change, which I think was in your report, Will?
I think historically it was thought we couldn't get it through. You know, I think Kate's left, but when she put her bill up in the last Parliament, it was there was bipartisan opposition to it, and I thought, the minimal, and I think the thought was, well, let's get something through, let's put something minimalist. But I don't think there's any disagreement in this room that the second option that you've put forward is a better option than a defence where the defendant bears the onus of proving all the things that they have to prove.
And the two models may actually work together as well. I don't see them as necessarily competing concepts. In fact, the defence would be able to be instituted immediately while we work on, the guidelines for police to deal with impairment, or as another safeguard. So I think that I can tell you what we're doing is we're looking at a whole bunch of options, and I've made it clear what my view is when it comes to just having the court test. They're not being sufficient. But I think these concepts don't necessarily work apart. They may work together or implement or complement each other, and potentially in a timed or staged way as well.
I think it's a symptom of we're at the pointy end of the reform, where all the options are on the table because there's been issues emerged. There's been new laws enacted about grievous bodily harm on roadsides, which will catch medicinal cannabis patients, mandatory testing there. So all of these issues have been, and these options are being put on the table because they've emerged through this inquiry process, the Drug Summit process, and we've put them in front of the government. We're now asking them to respond through the various agencies and ultimately through the Parliament. But look, everyone, thank you very much for coming today, for all the advocacy you do. I forgot, it was remiss of me not to mention Uniting, the great work that they've done, and the HSU, their advocacy as well. I'd like to thank my office and Alex's office for pulling this together, the Legalise Cannabis Party team for coming along. So thank you very much, everyone.
Thank you, Jeremy.
We hope to have some legislation in the Parliament before the end of the year to be voting on. That's our push with the government, and we can drive this change, this reasonable response to a big issue for hundreds of thousands of people. So thank you all for the work you do, for coming today, and we'll see you again soon. Thank you.
Thank you, Jeremy.